Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, the message for today is about ACE inhibitors for the treatment of hypertension. In the last few days, I have covered general treatment of hypertension, primary drugs for the hypertension, backup drugs for hypertension. I have covered diuretics in detail, and I have covered beta blockers. Today, I am advancing our discussion to ACE inhibitors in the treatment of hypertension. Angiotensin converting enzyme inhibitors are the first drugs that have been shown to block renin-angiotensin aldosterone axis. They have been widely used for the treatment of hypertension, especially in patients who have congestive heart failure or who have compelling indications such as diabetes or proteinuria. So for a long time, ACE inhibitors have been used for the treatment of hypertension, either as monotherapy or in combination with other antihypertensive drugs. If you're choosing an ACE inhibitor for the treatment of hypertension, I would request you to choose a long-acting ACE inhibitors and not use short-acting ACE inhibitors. ACE inhibitors are not as effective as angiotensin receptor blockers for the treatment of hypertension. You can use them, but preferably in combination with other antihypertensive drugs and preferably in patients who have so-called compelling indications. RAAS blockers in general have specific advantages in patients with pre-existing cardiovascular disease, diabetes, chronic kidney disease, metabolic syndrome, etc. They are quite safe, but when you use an ACE inhibitor, please keep an eye on serum potassium levels occasionally and also serum creatinine levels occasionally, particularly if you're using the drugs in patients with chronic kidney disease. Keep an eye on the potassium and also on creatinine. So in summary, ACE inhibitors are an older RAS blocking drug class, and one should select a long-acting ACE inhibitor over a short-acting ACE inhibitor. In my opinion, angiotensin receptor blockers are more powerful to reduce the blood pressure compared to an ACE inhibitor in general as a group of drugs. But I have given you a few comments on ACE inhibitors as an option for the treatment of hypertension, like other drugs, either as monotherapy or in combination with other antihypertensive drugs. One should not combine an ACE inhibitor with ARB for the treatment of hypertension. There is no evidence that they're helpful. So keep this in mind.